I'm Dr. Noojan Kazemi, and I'm a neurosurgeon at UAMS. Low back pain is a complex condition. Many patients suffer from it. I think we all suffer from it at some stage in our life. And for those of us that are unlucky, it continues and it causes great limitation in what we do. So it affects our activities of daily living, including getting around, playing the sports that we want to, interacting in a mobile way with our friends and family and so on. And over time, it can become a cause for chronic pain. So I think that when patients present to me with low back pain, I try to understand the evolution of that pain and see what's happened to them, whether it be an injury that provoked the back pain or not, or it's a result of the work that they've been doing, or perhaps it's just as they've aged, their pain, their low back pain, which was manageable in the past, has become worse. What I always tell patients is that the spine, like any other part of the body, it's not static. It doesn't sit still. It's growing, it changes, it's influenced by different forces and pressures and so on. So one of the most common things that I tell patients is that they should exercise. I think that muscle strengthening, both in terms of the spinal muscles or the paraspinal muscles that are in our back, are very important. These structures are very important to be exercised and to be strengthened, especially as we age, because whether it's visibly obvious to us or not, our muscles are replaced by fatty tissue and fatty fibers over time. And this obviously means that the muscles don't work as well. You know, they're not as supple and as strong as when we were younger in our lives. If the patient's low back pain continues and persists and it is severe, then it needs to be investigated. We can target specific treatment, and that includes surgery, but it includes things like physical therapy and judicious use of medication, somatic therapy when required, and also giving the patient an opportunity to ask questions about what they can and they can't do, physical limitations, and also understanding that their spine problem is also a problem that's in evolution. When I see them, I have a snapshot of what they're suffering, and they may have been better, they may have been worse, but I think we need to take all of that into account to formulate good treatment for them. If it becomes obvious that their pain is severe enough to need some form of surgical correction, this would really involve decompressing a nerve. It would involve stabilizing a mobile segment in the spine, which in itself can generate pain because instability can be a cause of pain. And also treating, as we mentioned, spinal imbalance and correcting the imbalance of the spine. So these are three things, specific things that as a surgeon, spine surgeon, I'm able to offer these patients.